Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness.
Nice to meet you. And what kind of question do you have?
Yes, sir. Nice to meet you. So, I'm a physical therapist. I'm practicing here in New York, and I have always been fascinated with aquatic therapy. Can you tell us how aquatic therapy works and how it has fascinated you and your life?
Of course, aquatic therapy is a really special environment, and this environment is perfect to come back in the movement because a lot of patients with chronic pain they
Right.
have they avoid any movement because if you have pain in your body, you don't want to move because the tissue is strong and you don't want to move because you're afraid of you get more pain, and so you go a different way in the warm water. And so you have a good possibility to work with the patient, and he's motivated to come back in the movement. Yeah, this is really important because otherwise the muscles are getting more tight and short and also weak. Yeah, this is a process. This is not good for come back in the recovery and for the rehabilitation process.
Correct. I agree with you. Being a physical therapist, it is so difficult for the movement to just start to begin. So when do you think would be the right time for aquatic therapy? Because a few patients are quite sensitive and it's very uncomfortable to start. But when would you?
Yeah, okay, the wounded, if you after surgery you have to take care for the scarf or wounded, you can put item for take care or secure because the chloride water cause a bacterial infection, but after the physical therapist or doctor say it's okay, you can go in the water, you can try. Also with help from the therapist, it's not necessary to you can walk. Yeah, it's possible for everybody. And okay, some contraindications do you have? But I worked. I have experience also with patients with epilepsy, and it's also possible to work in the water. And,
So what precautions do you take with such patients? What precautions would you take with such patients that have neurological dysfunction or like epilepsy?
Yeah, you have to check up with the neurologic doctor. It's possible or not, and maybe you have a mother or father from the patient or from the family. They know more about the behavior from the patient, and then it's possible. I guess I have the experience, and but mostly you have patients like multiple sclerosis or after apoplex and with hemiparesis or with spastic. Yeah, this is and Parkinson, and yeah, this kind of disease is grow up. Yeah, and a lot of patients with diabetes. Yeah, and fibromyalgia, a lot of chronic diseases. Yeah.
Right, that's true. So how is the healthcare system in Germany? How would you say it is?
Yeah, it's quite good, but a lot of hospitals are private, and so they spend not so much money for aquatic therapy because it's really high cost, energy cost in Germany. And so a lot of hospital manager will delay this kind of offer. This is, yeah, it's really sad. And the problem is the most clinics or hospitals in Germany are private, holding. And this is, yeah, but some rehabilitation clinics, especially for chronic pain or pain patients, has this offering, also aquatic training with devices in the water. And this is a really, really good offering for the patients. And in Germany, it's not so popular that you have small private hospitals. Maybe in US more, no?
Correct. There are quite a few of private hospitals, and yeah, the insurances. I feel like here there are a lot of chances for us to work with allied sciences like chiropractic, needling, aquatics,
Yeah.
a lot of things. So we can really try to get, but again, like you said, it's a little pricey, it's a little expensive. So you have to be, we cannot prescribe it to everybody.
No, it's not for everybody, but for patients, they want to try this special kind of rehabilitation or treatment. They are maybe be able to spend a little bit more money for this kind of treatment, and it's really valuable. Also, I guess it's a good effect, really great benefit for the patients, and the patient knows that you need more energy cost, and it's not a normal physiotherapy treatment. Yeah. And so I guess it's a good possibility to offer special kind of treatment. I like not the normal movement in the water or rehabilitation program. I like to combine the osteopathic medicine with aquatic therapy. You can handle or you can do a lot of techniques in the water from the osteopathic medicine, and this is really high effect and really good benefit, and the patients love this.
Correct. That's really, the combination therapy is really working well today with osteopathic therapy, like you said. If we combine a lot of therapies together, it's for the patient, the recovery is good. It's very well for the, it's recommended for the patient today.
Yeah, because in the water you don't have so much gravity, and it's really easy for the patients lay down in the water with buoyancy items, and so it's also easy for the therapist to work with the cranial or with the skull and the neck and with the lower body. You can go under the lower back, and you can do vibrations, and you can increase flexibility. This is really important for the beginning in the rehabilitation.
That's true. So did you find that the recovery time with aquatic therapy was less with just normal therapy?
Definitely less, because I have a lot of experience with patients after with multiple sclerosis or after apoplex, and they can walk earlier than on the land. Yeah, or you combine both therapy, because on land they cannot come back in the walking, but in water they can walk. And this is really good for the neuromuscular system and for the connections between the motoric system and the body posture. and this is even a great effect for the motivation. Yeah. Oh, I can walk again. So long I can't walk. Yeah? And this is yeah, it's amazing what you can achieve in the water.
That is right. That is so true. So what do you think about, what is one misconception that you have heard about aquatic therapy that you do not agree with?
Misconception? What do you mean?
That you hear people talking about something, but it's not true at all about aquatic therapy.
I don't know what the people talk about that because this for me not important. I like that, and all what I do is good for the people, and so the people talks good about this kind of therapy. And because okay, some people thinking, oh, this only in the water is not a load or not. This is not sport or not therapy. This is only for old people. Yeah, but that's not true. You can use for all kind of ages. Yeah, for children, juvenile, and adults. No? This is really good, and I use it also in my praxis. I have the last weeks I had some young patients. They have a supination trauma or problems with the ankles, and you can kinesiotape and then immediately in the water, yeah, can running because the edema is reducing time is much better in water. It's for the lymphatic system, and so they can work really definitely earlier.
So would you suggest it for lymphatics? I'm a certified lymphatic therapist here. So would you suggest for lymphatic patients to do aquatic therapy?
Of course, this is necessary because sometimes you have not so much therapists for lymphatic drainage for the treatment, and it's not enough. You can use lymph drainage and in the afternoon aquatherapy. It's really important. The running, walking in the water, deep water. So the lymphatic system it's the best, one of the best treatment.
That is, I never thought about that. I will start suggesting my patients. I had one patient with knee surgery, ACL tear, and he's a very young patient. So we started with plyometrics. We were at an advanced stage. So I told him, we did not have aquatic therapy at our setup. So I suggested him, why don't you go swimming? So he took his son and he went swimming, and he could do so many things. He could really, the movement was really so flexible. And I also observed an increase in his end range. So the last 10 degrees was lacking with the knee flexion. But after he was swimming, I could see the difference. The aquatic therapy really, just swimming, not even aquatic therapy session, just swimming, it increased his range, the last range, and I could see the difference. It was really impressive.
Yeah, this is the best combination is water and land, and you need for the rest of rehabilitation for come back in the full load possibility for the completely fitness. You need the completely flexibility, and in the water is easy. You can also work manual. Yeah, you can do a traction from the joint, and you can manual therapy you can do in the water. It's really good and really important because if you have not the full flexibility, you are not 100% fit. Yeah.
Correct. That is true. If you don't have the last range, complete flexibility, that means you're still lacking and you need to work on yourself. So what is one latest research that you read about aquatic therapy that you found very interesting?
This is a long time ago because actually at the moment I don't work so much in the water because I have a lot of patients on land for osteopathic medicine and homeopathic medicine, and I work with my hands a lot and not so much time. And my doctor thesis is some years ago, but I can write you later. And I will check, okay, if it's okay,
Sure.
you agree?
That's
Sorry,
okay.
I cannot talk about it, but I can bring you this this articles.
Okay, that would be really helpful. Thank you so much, sir. So,
Thank
what
you.
would be one piece of advice that you would give to any therapist who is starting with aquatic therapy? Well, what do you think he should know, he or she should know about aquatic therapy?
Yeah, I guess important is most important is the practice. Yeah, a lot of practice, and yeah, it's the motivation to touch the patient in the water, and you can try in the vertical position, you can try lying position. Yeah, you have to try to work with the patients close to your body. Yeah, and most important is that you are for yourself. You have to be safe in the water. Yeah, and you observe always your patient. Yeah, because in the water, warm water is a different environment, and we have a lot of chronic pain patients, and they have take a lot of medications, and you don't know how is the reaction in the water, and so it's really important to talk with the patient. You are okay. How is the feeling, and how is the color? And I guess this is most important. Yeah, and so you get a lot of experience, and then you're getting your self consciousness better and better.
Right. So, do you think telehealth is the next step to healthcare?
Hmm?
Do you think telehealth, like doing healthcare on the phone, on the computer, is the next step to fitness or no?
No, I guess not, because the patients needs your hands and to touch and a guidance, yeah, in water and land too. Yeah, I guess the human you cannot. It's not the same.
So we're coming up with so many technologies, robots,
Yeah,
AI, so much.
but this is no, I'm not sure. I'm not satisfied about that. I guess it's not the right way for the treatment. It can help in different kind of fields, but
Correct.
in the therapy they need the human.
Right. That is so true. Thank you, sir, so much for giving me your time and just talking, just sharing your thoughts. And I hope you have a lovely meal with your daughter. And
Thank
thank
you,
you so much, sir, for everything.
thank you, and yeah, I'm happy about your interest and hope I can help you anyway.
Thank you so much, sir.
Thank
I
you.
look forward to it. Thank you.
Thank you so much.
You're
Bye
welcome.
bye.
Bye. Have
Bye
a good
bye.
night. Bye.
Bye.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.